A 74-year-old woman presents to the emergency department with a 2-hour history of lip and tongue swelling. She tells you this started after a wasp sting whilst gardening. On examination, you note urticaria on the patient's neck. She is talking in full sentences and auscultation of the chest is clear. Observations are heart rate 87 beats per minute, BP 132/76 and respiratory rate 16 breaths per minute. You note that the swelling has remained stable whilst in the department. What is the most appropriate treatment? Options are A. 500 micrograms adrenaline intramuscular, B. 10 milligrams cetirizine and 30 milligrams prednisolone oral, C. 5 milligrams salbutamol nebulizer, D. 180 milligrams fexofenadine oral and 10 milligrams chlorpheniramine intravenous, E. 30 milligrams icatibant subcutaneous. Answer is B. 10 milligrams cetirizine and 30 milligrams prednisolone oral. For urticaria and allergic angioedema, administration of a large dose of a long-acting, non-sedating antihistamine, for example, cetirizine or fexofenadine, together with a single oral dose of prednisolone is usually sufficient for the management of symptoms. A 32-year-old woman presents to the emergency department complaining of a raised, red rash over her torso. She describes an intense burning and itchy sensation of diarrhea. She takes multiple medications for various chronic health complaints. You suspect a drug-related urticaria. Which of the following drug classes is most commonly associated with drug-induced urticaria? Options are A. Angiotensin-converting enzyme inhibitors, B. Statins, C. Beta blockers, D. Nonsteroidal anti-inflammatory drugs, E. Benzodiazepines. Answer is D. Nonsteroidal anti-inflammatory drugs. Drug-induced urticaria is often associated with antibiotics, penicillins, aspirin, NSAIDs and vaccines. Chronic urticaria, urticaria that lasts for 6 weeks or longer, typically on most days of the week, can be spontaneous, chronic spontaneous urticaria autoimmune or inducible, chronic inducible urticaria. CSU occurs with no known identifiable external cause. However, symptoms may be aggravated by heat, stress, certain drugs, for example NSAIDs, and infections, for example viral infection and Helicobacter pylori infection. AU is characterized by the presence of immunoglobulin G, IgG, autoantibodies to the high-affinity receptor for IgE. It accounts for about 30–50% of chronic urticaria cases and may be associated with other autoimmune conditions, such as thyroiditis. CINDU occurs in response to a physical stimulus.